Good morning, everybody. Thank you for joining us once more. Um, I've been smiling all morning because my technical person right here, Mr. Ulan, has been very funny, keeping us smiling. So yes, um, yes, you do. Go ahead. So shout out to everybody listening. I'm hoping we have some persons calling in. We have some comments to let us know that you're listening. Um, to my colleagues in the Sufre office, Viewport, Castries, wherever you are, you're listening. Pleasant good morning to you. Good morning to the staff of. Okay, I will let the colleagues of the staff say good morning to them this morning. I always say good morning, so I'll allow them to do that this morning. So, wait, first, you're seeing two beautiful ladies. I am going to allow them to introduce themselves and they're going to tell you why we're here today. So, over to you, beautiful ladies. Go right ahead, introduce yourselves, say your shout outs, and so on, and tell us why you're here today.
Okay, good morning to the people of Sophia. My name is Dr. Elia Popon. I work with the pediatrics department at OKEU. It's a pleasure being here with you all this morning.
Good morning to the people of Sophia and St. Lucia. My name is Dr. LaShawn Christian. I'm a pediatrician and the head of department at the OKU Hospital. And thank you for having me in this lovely town today.
Okay. Thank you for coming down this morning. Let me tell you, listeners, I'm so grateful to Dr. Christine, and because she was like, "Oh, is it really today?" And she is here, so I'm quite grateful for that. Okay, thank you so very much for being here. So, again, I did hear her say, both of them, that they are from the OKEU
OKEU.
hospital and they are all the way down here in Sufre. So, my other guests, you'll make an effort next time. Okay. So, tell us, tell us this morning the topic that we are going to be discussing, and give us an idea why. Why was this topic chosen? Why did you agree to do this topic this morning? Yes.
So the topic this morning, I might reword it different ways throughout the interview, but essentially the essence is child sexual abuse. But we'll be focusing on the long-term consequences or side effects of child sexual abuse. And we chose this topic because at our hospital, like Dr. Papone and her colleagues, they're the one who will examine any, subject or any child who comes in who are subjects of child sexual abuse. It's very traumatizing for the physicians. It's not something that we enjoy doing, but we do it because we have to serve our children. And the people only see the now, and just like everything in life, it's a 9-day talk, and then by the 10th day, it's forgotten. It's forgotten by the public, but for the victim, it's a lifetime of trauma. Hence why we decide today we are going to address this topic. Is a topic that a lot of people they try to shy away from. It's like you're not supposed to speak about it, and not speaking about it doesn't mean it did not happen or it is not happening right now.
Thank you so very much, Dr. Christian, for that. Um, like we were discussing a little earlier, that it is not that sexual abuse have become more prominent. It's just that we have become a little bolder with it. It has been there. It has been happening. So right now we want to place focus on sexual abuse and the effects that sexual abuse has on our children. Because like you heard Dr. Christian said, um, today we talk about it, we make an issue of it for today's and it's gone, swept under the rug. Okay? And most times what is so heartbreaking for us, both the physicians and the social worker, everybody involved, is that most times you find, unfortunately, and I'm sure you would agree with me that sometimes the victims are seen almost as if they are the criminals. What do you-
Yes. Okay, yes. So victimization of the of the subjects or the issues of child sexual abuse is very common. I don't know if it's like a mechanism where persons want to just ignore it. And so a lot of time, even if you're not a child and it's a female who was violated, the question will be asked, but why were you walking along the road at 11 o'clock? Why were you wearing that tight revealing clothes? Oh, she must have didn't like the guy. Why was she at his house? She was probably at the house because it's CXC time and it's time to study. And he was like, let's go and study. And she thought it was just studying, right? So a lot of time it's like we're basically putting all the blame on the subject. And bear in mind, it's not only females who are being abused in any society, even here in St. Lucia, males are also being abused. But as we know, most often it is a female that is experiencing some form of child sexual abuse or abuse. And we always want to know, but she should not have been there. She should not have worn that. Maybe she smiled at him. Maybe she took his money. That doesn't mean that it was right for that person to abuse this victim.
Very well said. And these are the common comments that we will be hearing on a daily basis when something happens. You don't hear enough. Oh my goodness, I'm so sorry for the victim and so on. You hear more of what did she do to get herself in that situation. Okay? When it comes to we're going to the what is our age of consent in St. Lucia?
Okay, so the age for sexual consent,
Age for sexual consent.
meaning you can say
right.
yes to have sex and it is not against the law, is 16 years of age. But the age of consent in terms of you becoming an adult when you can sign off on your own loan or sign off on your own surgery or make your own decisions, that age is at 18. So you can say yes to sex, have a child, but if you need a C-section or if your baby needs a surgery and you're 16 years old, then you cannot sign for that part of your life.
Okay. Also, as a 16-year-old, you can't consent to sex. Can you come to clinic on your own?
There is something called assent, and I also see teenagers. And if a teenager wants to come and see me, whereas it's not the first time I've seen that teenager, but I would have seen them before, and they have an appointment that they don't want to miss. And once their parent is okay with that, I'm fine with seeing the teenager. But the reason being, a lot of times people want the teenager to be seen and not heard. And so I don't have a problem seeing that teenager on their own. However, that may not be a general practice for other healthcare providers. They will still want the parent to be there, especially when they have to consent to things like contraception or certain procedures.
Great, and this is what that would have been my next question. Can a teenager come in to purchase contraceptives, even like condoms, and go on contraception on their own?
No, they can't. The parent will have to give their verbal consent. And even if the parent said yes, and I give a prescription for the contraception, the parent has to fill it under the laws of St. Lucia. But in other countries, you have emancipated minors. They live on their own by the time they're 15, and they can buy their own meals, pay their own bills, and they can pay for their own contraception, and it's okay.
Okay, thank you for that. So with laws, as I've said before, and I'm saying it again, and to who is listening, the persons who are listening in authority, when we give liberty for one, we give laws, we must attach the responsibilities to it. And I'm seeing that an age of consent will, okay, it's okay, I'm giving you consent, go and have sex. But the responsibility with that, you took it away. Okay, so a child cannot go and buy contraceptive on their own. A child cannot come to the hospital on their own. All they can do is say yes to sex. Okay, so I'm really thinking that we need to adjust that. We need to change that. Very much so. All right. My next question. A child is of age of consent at 16. However, you will hear persons in society saying, you know that 12-year-old seeing that guy, she's saying that she'll like it. Okay, she'll like it. Please educate the public.
So let's go back to the legal part of it. Between the age of 14 to 16, there is a gray area. So if you're 14 and your partner is 15 and a half, 16, I think it's up to a 5-year gap. So I think up to maybe 19 if you're 14. having sex, I think I'm not a lawyer, but from when I did my research in terms of the law, the sentence would not be as harsh as if that gentleman is 30.
Yeah.
But there is a downside to it, or there's a flip to it. So if your son, who's 15, and my daughter, who's 14, decide to have sexual intercourse, and I decide to to challenge your son because he had sex with a minor, you can also challenge my daughter because your son is still a minor.
I was just about to say that. Yeah, both minors.
They're both minors.
Both minors.
Yes.
And recently we did have a program with a lawyer to with these fine lines disputes,
Yeah.
because many times persons do believe that the law just stands for the girls and not the boys. It stands for both boys and girls.
Yeah.
So 16 is the age of consent. Below that, from 15 down, okay, you cannot consent to sex. So if two minors at the age of 15 have sex, if you challenge my daughter, I will challenge your son and vice versa. Because you're not supposed to be having sex, and both of them should bear the responsibility of what happened.
Right.
Okay?
But even though a child can give assent to say yes, however, even if a child says yes, under the law, it is technically not valid because a child cannot consent. So a 12-year-old having sex with a 30-year-old, even if she said yes and the people think she like it and they think it's a relationship, legally it is not a relationship because she cannot say yes.
And what do we call it? Well,
It's statutory rape.
statutory rape. I'm hoping that persons are listening. Okay, so it's statutory rape, automatic rape, because this child cannot consent. So persons out there who are having sex with minors below the age of 16, they cannot give consent below the age of 16. You are actually raping this child. Okay? So as long as the child is not 16, no, they cannot consent to sex. It is rape. So whether the child, as you heard Dr. Christine said, whether the child says yes, Ipania voix, that's a yes. Okay? You cannot take that yes because she's below the age of 16. All right? Many times, Dr. Christine, we would hear that minors are abused. There is an allegation out there that a child will come and say that, a gentleman touched me, somebody did this to me, and so on. And in St. Lucia, well, I'm not sure for other countries, what we would do as workers, get the police involved. The police, we call them vulnerable persons team, excuse me, that is VPT. So we would, along with VPT, take this child to the hospital, and a medical will be done on this child. Most of the time, certain things in this medical will state whether there's evidence that this child was even penetrated, somebody did interfere with that child, and sometimes based on the medical it would show that nothing physical happened to that child. I need you to speak on that. Let's shed some light on this for me, please. Both of you.
Okay, so I'll Dr. Popo to start and then I'll finish.
Okay, so a lot of times, as being one of the physicians who does the examine on the girls, because we mainly see little girls, there's no physical finding of any sort, right? But a lot of times that there's a delay in the victim being brought for a physical exam. Let's say the event happened and then they come in about a week later. We won't see any signs of trauma. We won't have that opportunity. The window for having a kit done is now closed to collect any specimen that could, point us to some form of evidence, right? But we still don't disregard that it happened. Because at the end of the day, the victim is the one in that position. And as physicians, we have to say, okay, I do not see any signs of trauma, and then we would alert the authorities or the next of kin that is accompanying the child, but that does not mean it did not happen, right? So a lot of times, even with variation with anatomy, when it comes to the science, we would say, okay, there's a possibility, there's not a possibility. Sometimes some things are subjective. We get a different eye, have a senior take a look to see, okay, is this what I'm seeing, is this what I'm seeing? But majority of the cases all unremarkable, no evidence, but that does not mean we disregard the fact that it happened. So that where we are prompting the public when these situations happen, that the victim is brought in as early as possible if we actually want some form of evidence.
Thank you, Dr. Popon. The other thing too, we need to remember, not all cases of sexual assault involves penetration. So if you touch my breast, you have assaulted me. You're not going to find any physical signs. And sometimes, I mean, this is a public space, but insertion of the finger into the cavity, you know what I mean? You're not going to see much of a sign. And if it happened, for instance, 10 years ago, because sometimes the victims are bribed, so they give them ice cream and lollipop and sweets, or they threaten, oh, I'm going to do this to your family if you say anything. They don't speak up right away. Then one day they become empowered, or they hear maybe that same perpetrator is doing it to other persons. And then when they speak up now, 10 years ago it happened, we're not going to see any solid sign. However, there's another twist to it. The hymen, it doesn't leave a scar. So a lot of people tend to think that once you have sex, you're going to see an open space when you do the examination. And a lot of times what will happen, because it has a tendency to almost want to heal itself without any scarring. So if it happened 10 years ago, even with penetration, and you come now and you haven't had any other encounter since then, you're going to have a normal looking hymen that doesn't look as if it was ever penetrated. Doesn't mean it didn't happen. So as Doc said, if you come right away, you might see the redness, you might see the bruises, you may see some active signs, and you would confirm the DNA with the kit she spoke about, but 10 years later, you're not going to have none of those.
Okay. Have there been situations where the child was brought in early enough and something did happen, some form of penetration did happen, however, the hymen was not totally severed, it did not come out, or there's no sign to show that this child was penetrated? Has there been any cases of that?
It can happen, and that's the reason why, especially in children, because of the shape of the hymen, different to an adult, and the shape of the hymen also vary to if you started having hormonal changes associated with puberty. So the puberty hormones make the hymen look different versus when you're younger and you haven't been exposed. So for the children, sometimes we have to, instead of examining them on their back like you would for any female, you have to put them on their belly with their chest on the bed, and you basically lift the bottom in the air. So that opens up the vagina so you can get a better view of the hymen, because if not, you might miss findings. So you also have to know how to vary the examination to get a better look at it.
Thank you so very much for that. Yes, because most times you would find that that would be the determination as to whether or not this child was penetrated. And sometimes the child will tell you, yes, something happened, but the medical says otherwise. And because of that, many cases would go down the drain.
Right. And we can only write what we see. If we're seeing that everything looks normal, we can only write that, because we don't want to write what we're not seeing and then end up incriminating or, casting a misjudgment. So we only can write normal if it looks normal. But as they always say, as Doc said, the majority of the cases, the examination is normal. Doesn't mean it didn't happen.
Okay. Wow, that is tough.
Yes.
Because I was just thinking, but what can determine that something did happen?
Okay, so once you find the perpetrator DNA right there, how did the DNA get there? You better have a good explanation for that. So that alone is a giveaway. Hence why we encourage persons, if it happened right away, do not shower, just come straight to the hospital. However, even if the person did shower up to 72 hours, up to sometimes 5 days, you can still, when you do the rape kit, you can still find evidence of DNA. But you have to make sure also, we as physicians, we have to collect the sample properly, store it properly, label it properly, because we don't want to have that mischaracter on our part. Okay?
But I'm still asking again, what if it is a situation where this person did not ejaculate on this child, and it's say an ongoing situation where, for example, an uncle is raping a niece, and well, not every day, and I guess maybe he takes his time.
Yeah.
He does not refer up and so on, just getting a little in there, getting a little in there,
Mhm.
and not taking his time.
Mhm.
And then you do that medical
Mhm.
and notice that it seemed normal.
It can seem normal, but you would have sometimes you'll have little notches, like little tears, or like a little, like a V shape in it, and you know, okay, something did happen. So even if there's no redness to say, okay, it happened last night, or no bruising because it was forced, you would see a little notch that will say, okay, something did happen. But as I said again, remember, sometimes, because I don't know, like we're all adults, and then, I mean, their children probably listening, but you know, the fact that it's the hymen is always there, that's the feel that people will get, and so it's not something that once there's penetration, it's just going to open up. But you have to look carefully to see, because a notch will give it away, the DNA will give it away, bruises will give it away, and then a lot of time is based on the evidence of the victim.
Okay. Okay, thank you so very much for that, Dr. Kristen.
Mhm.
Um,
Oh,
sorry.
yes,
Go ahead.
yes, I wanted to. So you have the first time assaults, and then you have the repetitive assaults. Like you have the ones that are just like you mentioned earlier, the 12-year-old, the 30-year-old male. When these, let's say, for example, the parents find out, and then they decide to bring the child in for an exam, because that child and that male has always been involved, we're not going to see any form of trauma, right? If the nudge is there, we pick it up. If there's a laceration that didn't heal properly, maybe we pick it up. But generally, it's just going to be a normal hymen, because the hymen doesn't all disappear after sex. You have remnants of it. That's how we know, okay, maybe there was perforation, maybe there was penetration or something like that. And it gives different characteristics, based on whether or not if they were penetration. So we could just, most of the times we say, okay, sometimes we say the hymen, because the child is so young, it looks like it's intact, or sometimes there's just remnants of it, right? And there's just an opening. Some people have very narrow opening, some kids do not. So there's a variation to it. So we can't just say, okay, it did not happen, or there's no justification that that man really did that to this woman. So we take the patient's history, which is important. And it's important for parents to trust their kids if there is trust in their kids. And then we, based on our physical examination, which most of the time is unremarkable, but we do also lean into the history of what's happening, and we get to know a whole lot more than they ever knew.
And thank you for that. I'm hoping that many persons are listening and understanding, okay, because this is something that really plagues us, that many times cases go down the drain because of, and what you hate, but that the doctor said that, so how can we go against what the doctor said? So you are hearing, folks, that it's not black and white. So there is just a lot more to it. So when a child gets, excuse me, when a child gets molested, or allegedly the child comes and says, something is happening to me, not because the report says, okay, I did not see anything happen. The report says it's unremarkable, like the doctor said, that you would say, you see, maybe what they do we kamanti, what do we kamanti LA? Because we are quick to cover our tracks. We are quick to blame the victims. They are victims. Do you think anybody would call that on themselves? As sexual abuse? Okay? And we know that is very prevalent in St. Lucia. Let's talk about the prevalence of sexual abuse in St. Lucia. Doc, do you have any idea, as you could see, we could use just an estimate of saying maybe in St. Lucia we could see 2 out of 10 girls. Do we have any research?
Yes, I actually did a research which was conducted recently. So the only shortcoming of that research that I did, it was during the time of COVID, and so the hospital visits were curtailed because of the COVID restriction, and only if you were very sick then you were advised to come to the hospital.
Yes.
But based on that small, it was a very small subset. So if you want to say for every 1,000 girls or patient or children, there were basically 14 persons who were affected. Now we may say that's a small number, but then remember during COVID, a lot of children were forced to stay home and they were subjected to it and could not come to the hospital. So maybe if we revisit the study now that we're out and about, we may actually see larger numbers. What we also found in that study, like in any other country, females were more prone to being victims of child sexual assault. The most common age group was between 11 to 15 years of age. That's the time when you know you're less likely to walk a child to the supermarket and she will now be venturing out on her own. However, we did see that babies as young as 1 year, 2 years were also presenting during that time, right? Yeah. And most often it was by someone who was known. That was like almost 80%, someone who was known to the victim. So it wasn't a complete stranger.
And this is something we really need to speak about, because most of the time when children are affected by sexual abuse, it would be by somebody they know. It wouldn't be a stranger. Most times it wouldn't be a stranger. So when Uncle Tom comes home, parents, Uncle Tom is always bringing the lollipop and Uncle Tom is always bringing the snack. Oh, Uncle Tom love the child. How can the child say that? Uncle Tom taking care of the child. Uncle Tom, no. Yes, watch Uncle Tom, please. Okay? Do not allow your child to be sitting on Uncle Tom. Do not allow your child to be removing the gray hairs for Uncle Tom. Okay? Do not allow Uncle Tom to be alone with your child or babysit your children, because you are not aware of it. But this is just the process of molding. Okay? They are starting to mold the children into what they want. They are now trying to groom them into what they want them to do. And eventually, when this child now is very comfortable with Uncle Tom, this is when Uncle Tom is now going to tell him, come sit on me. Of course, I don't see anything wrong with it because that's my Uncle Tom. And they will go and sit on Uncle Tom, and next thing you know, I was reading an article, I think it was an article, where this young lady came out to give her story, and she said that she confided in, I can't remember if it was a neighbor or an uncle, and this person took very good care of her. This person, she was going through some stuff, and this male was there for her. He would sit and listen to all her cries and everything. I think at the time she was maybe 12 or 13. And he stayed around and listened, and this was a go-to person, a support system, everything. As soon as she turned 16, the tables turned. And now he became touchy and she said that he started doing things that were very uncomfortable. But she felt like she kind of owed him because he had been there so supportive for so long that she felt like she owed him. So she allowed whatever happened to take place. Do you know of any example? Not know, sorry, because we cannot due to confidentiality. But have you heard of any incidents like that or can speak of?
There are many stories like that, not only in St. Lucia, because I worked in Jamaica, working in Antigua and Anguilla, so there are many stories like that, where you find persons who just take advantage of the victim's vulnerability. But there is also something called re-victimization. So for instance, it's like, okay, you were assaulted when you were 6 and you were taken away from your mother, placed to live with another family member. And in that new home, someone else then take advantage of you. And then you're put into another home and it happens. And it's like, it's not like the victim is attracting it, but it's actually a thing and it's called re-victimization. Likewise, like when you have a woman who is in one abusive relationship, she leaves that and she gets into another and another. So you do have the extreme where they're taken advantage of because they probably confide in someone. That person realizes, hey, they don't have a father who will do anything to me if I touch them. Their mother barely pays any attention because they're listening to all of the vulnerable cues to know when I'm ready to pounce, there will be no defense. No one will stop me and I'll get away. And you'll find that happening too.
Yeah, I also find this was a very strange question because my sister and I were discussing not like last night that we were going through some situations we saw in our neighborhood growing up, and we're saying like, in the States they made the big thing about the pedophiles, right? But we actually had them there all along in our small communities, because you would have these men who, like you said, groom. They would be there and they would groom this little girl to a point where, okay, hey, it's time to pay off all of this. But at the whole time, these are just pedophiles being very patient and investing to get what they want from kids. So it's something that we have to be very careful in our society and try to open up our eyes even more to it, because it is happening. It's not as how it's lavishly exposed in the States, but it is happening.
Something that came to mind as I said that, and I think our pedophiles are becoming very smart now. Um, they move from the front now to the back. We've been hearing some stories of the children. They do not go. I will allow you to give us some more information on that. That they do go inner with the children. Has there been
The Google.
inner? They
Oh,
don't go
oh, oh, oh,
Mm.
yes, yes, yes,
Mhm.
yes, yes, yes. Yes, and I don't know if it's because we're more exposed to technology, and as Doc said, the American influence, and it's now a thing, and um, because remember the hymen is a very tough tissue, so you might get a lot of resistance, especially if the victim is fighting, and so it's like anything at this point. If it's not the vagina, then it's the anus,
Yes.
and literally you're seeing anything. You're not holding back.
Right, because I've heard of situations where um, it's being said that now the pedophiles go through anal because there's no sign. It's very hard to detect because they say, okay, there's a hymen there to give away something happened, but now with the anus, there's nothing to give away unless if it was caught early and there are bruises.
But so that's why we still have to ask our subjects or our victims, like, okay, what happened in the scenario, just to get an idea of how far we should go with our examination. So if the victim reported that, well, yes, it happened 2 years ago, but he did that, you can still see some signs like skin tags. So these are little like out portion of the skin around the anus. Sometimes they may actually have fissures, which are tears in the bottom. Sometimes that may be the reason why they come to, present to the hospital, because the parental guardian may notice soiling of the underwear, that there's this constant stooling. And so it may be because of constipation, but one of the things you always ask just to make sure is nothing else apart from constipation is, if the child is always supervised, and ask the child if there's any inappropriate touch, because the fissures, the soiling, sometimes they may get access to because the trauma was deep within and then it didn't heal properly. So you can see signs, but not all the time. And if you're not aware, you'll just focus on the vagina and leave the actual source of the problem, as you're saying.
So persons who are doing the examinations, it's advisable to do both front and back
Yes.
examinations. Great. All right. Parents, I hope you're listening. It's now students and our children. I hope that you are listening also, that you'll be very careful with persons out there. Parents also addressing the children that anybody who makes you feel uncomfortable, you have to speak up. You have to say no. You have to say no. Even if you're my father or my uncle, whoever you may be, it is not right for you to touch my private parts. It is not right. Even sometimes I hear grown men calling little girls sexy, because I remember getting in trouble, not in trouble, but a man almost wanted to curse me out because he said, am I from the Stone Age? When he called my young daughter sexy. And I said to him, no, you don't address her as sexy. You call her pretty. You can say pretty, but not sexy. She's not a grown woman. And he said, well, you come from the Stone Age? I said, yes, we come from the Stone Age. But these are the things that when it starts, grooming starts with words, okay? With just the words, the behaviors, and we take it in as a society. Also, parents, I am not accusing here. I'm just saying to be very vigilant. We cannot be too trusting of people by our children. I know we have the fathers, the stepfathers, the uncles, even the brothers. we have to be very vigilant. There are times you'll be in the home and you'll be saying, oh, but he prays to the child and he reads to the child and so on. Yes, when you are sleeping, you are sleeping in your room. Ensure that your eyes are still on, you're alert, and listen to your children. Because most times your children will come and say, Mommy, this happened to me. Daddy did this, or uncle did this, or brother did this. And, you lying. Okay? Parents, please listen to your girls. Alright? Because a lot of things, if it cannot be avoided, it can be caught very early. And as you heard the doctor say, that if it is caught early, there will be the evidence and this can go to trial. But when there's lack of evidence, very little evidence, a lot of times our cases go down the drain. All right? And as you heard, Dulcie. So back to you, doctors. When a child comes into the hospital with trauma, with sexual abuse, how would you say you advise the parents to work with that child?
Well, that has been a challenge for us actually. We do referrals to counseling, and we do inform the parents that, this is something that happened to your daughter, son, right? You have to try to be patient. They're gonna show different signs and behaviors that's unbecoming of them, but you just have to try to put yourself in their shoe. What if it happened to you, right? Because a lot of times the kids acting, there's their way kids act in society, and their character might say, okay, well, you put yourself in that situation for that fault, right? And then the child continues to act like that, or even act worse, or start acting out, and you tend to forget that that situation happened to the kid. And then you'll be like, okay, well, I can't do anything with this child. I'm not sure what to do with this child. I've been trying all my best, and it's just not working out for that child. As a parent, we try to advise that they be patient, as well as seek counseling, not just for the victim, but as a family unit. Because I consider it to be, at that point where this happens, it's a family crisis. It doesn't just affect the victim, it affects the entire family, right? So having the help that they need in terms of the psychological approach to it could also help a lot with the victims trying to overcome that trauma.
Thank you so very much. That's so important.
So one of the things that I always tell people when we look at a young lady, you can probably say it in Creole because I cannot say it in Creole. And this is a young lady who's very hypersexual with multiple boys. How would you say it in Creole? like you're the neighbor looking at her walking on the road and you want to say something bad about her.
They say, Jamet. Yes.
All right.
So I like to call the young girls out here.
Yeah, but what they don't know is that poor young lady, maybe at the age of 2, and she probably don't remember, was sexually assaulted. Now the thing is, trauma can imprint itself in our DNA and in our mind, and we may not remember every single day of our life in primary school, but bet your life that person still has flashbacks. She doesn't know what happened, but she knew something bad happened. And this is the body basically acting out on the trauma. So whereas the neighbor, they're calling her a Jamet, it's because she went through some form of trauma, and a lot of times that is what happened. So this hypersexualization, wanting to be with multiple guys, is like you keep chasing that. It's like an addiction. So the first time you tasted sugar, or the first time you went on the cell phone, you keep going back. So she keep going back to that emotion that was felt, but you can't get it. So you just go and go and go, right? And this is not where we're going to get into the actual psychological trauma. We spoke about the physical,
Yes.
right? This young lady, her mother cannot stop her, the teachers can't stop her, the neighbor can't stop her, not even the pastor, because she's on a road to destruction, not only sexually, but she might be cutting. A lot of children are doing that because that is emotional pain.
Testicle pain, right here. Is there, because I have spoken about it, cutting? What is cutting indicative of?
You have 2 types. So cutting in itself is based on classification. This is a fancy word now. They call it self-harm, but it is the non-suicidal self-harm, meaning you're not doing it to kill yourself, but because you're having such deep emotional pain, and nothing in this world, no amount of paracetamol, no amount of bush tea will take your pain away. Every time you make a stroke, you feel a release of your pain. And some people they use that as a way of coping. Now you have those who do it because they see it on TV and their friends doing it and they're doing it for show. Those are the ones that are, not so bad. But those that hide it, these are the ones I'm more concerned about. All right, they're not aiming to kill themselves, they're just trying to get rid of their pain by making cuts. Sometimes tattoo, some people who have multiple tattoo, it's a way of self-harm also. So you have some that do it because it looks nice. We have some who will put on a tattoo because it helps with some of the pain. Multiple piercings also. So self-harm is not just using a razor blade.
Yes. Thank you so much, because I remembered, I think, doing a research, and it was saying that 90% of children who cut have been abused in one way or the other.
Right.
So, okay, thank you.
Yes. So you will have the cutting, and then you will have those who are anxious. They just constantly heart racing, can't sleep. They're just fidgety. Or those who are depressed because they feel like everybody's now saying, "Oh, it's because of you. The neighbor did this to you. Now we don't have no more current because he used to give us electricity." And now it's like the child was like, "But what did I do wrong?" And now the doctor is saying the examination is normal. The neighbor not giving us current anymore. My mom is cursing me. That leads to depression. And once you start with depression, it goes on a long road. So you have your PTSD. So every time you see this neighbor, your heart races because you remember that moment. Or it could be when you grow older and you're married, maybe your husband might put on a cologne that the guy wore 20 years ago,
Yes.
and your husband doesn't know, and then you lash out at your husband for something he's not even aware of. Right? So it will carry on, it can also carry on intergenerational. So you're lashing out at your husband. Now, let's say it's a situation where it was a family member, and you see your partner looking at your daughter the way how that perpetrator used to look at you. You become now so aggressive towards that person because in your mind, that's the look I used to see, and you're doing it to this offspring now. So you plan to do it, and the person is not even aware. The person doesn't have that intention. It's just a paternal admiration for this little cute baby I have in front of me, right? And then sometimes some mothers, would then look at their daughter as, "You are the reason why that happened to me, and nothing is happening to you. But when I grew up, I had so much physical and emotional abuse, and you're just living your best life." So they become resentful towards their children, right? Let's go into the gynecological part of it. Painful sexual intercourse when you're now married and supposed to be, it's uncomfortable. And other, disorders we won't get into because it's a public radio station. But the physical, sometimes the body just cannot cope. You cannot walk, you can't talk, you feel a tight ball in your throat, you can't move your knee, and there's nothing wrong with it. You can't see, there's nothing wrong with your eyes, but the brain just cannot process that trauma
As an adult.
as an adult. And if somebody only wear red, and at the time he was wearing red, oh my gosh, you were doing well for the last few years, you were getting your counseling, and your manager or your coworker come in the office wearing that same shirt that person was wearing, and you lose it. And you're crying and you don't know why you're crying, but the brain registered something.
I'm so happy that you brought that on, because we did have, I think we have had programs before talking about childhood trauma, and that it is very important to deal with childhood trauma, because you go into adulthood with it. I remembered recently I was dealing with a matter where a child was allegedly assaulted, and I think she was saying, herself and her mom was saying, leave it alone. I can't remember anything at this point. And she said to me, I can't remember anything at this point. Just leave it alone. And I said to her, no, we have to go through this. It is mandatory. And I'm hoping the public you're listening that it is mandatory to report incidents of rape and child abuse. Because so many people will be like, me, the police are waiting way. I don't want the police to come for me. I don't want to go to court. If it is found that you knew about it and you did not report it, you can be fined. Okay, I don't have the legislation or the law right now to read to you. as to it's with aiding and abetting. All right, but you have to report. As professionals, persons would come to us and tell us, this happened to me. Myself as a social worker, the doctors here, they will say, Doc, that happened to me, but I don't want you to report it because my uncle will get into trouble or the neighbor will get into trouble. We do not have a choice. We are mandated to report. We must report. And we are not going against you by reporting to say, you see that you broke my trust, you breached trust and confidentiality. No, there's no trust or confidentiality here. We are not going to enable you to self-destruct because if we don't deal with it now, as you heard doctor said, that later on in your life, it is going to come up out of the blue sometimes. Because I know that sometimes when we're going on sexual abuse and assault happens, can you tell us sometimes that the child shuts down?
Verbally?
No, like they blank out everything that happened. Yes.
Yeah, they
They
do.
would. Can
They
you
do.
speak up? Can you
They
speak
do.
up?
For us in the pediatrics department, that's why our heads history, home education, drugs, suicidal thoughts or social thoughts are in that history is important to us because that child that incident may have never been reported unless say you come with a child who's for example having some let's say complaint of headaches for no obvious reason or having something looking like seizure activity and then the family members are traumatized by it so they bring the child to the hospital and we go into that part of the history and that's we tend to find out that that's where the cause of the problem is that it might not have ever been reported but we pick it up now and then we have to we yes it's a history that is done in confidentiality with just the physician and the child. However, if there's anything alarming coming out of that history, we are to take action. It's not like we want to breach confidentiality, but it's for that child's safety, right? So that is important to us. And a lot of times we do refer to counseling or psych for guidance, and majority of the time the root of the issue lies in that history and not even in a physical examination from a child that's coming displaying such symptoms.
Thank you so much.
Yeah. And that in addition to, so those symptoms she described, we call them somatization, meaning your body is acting out against it. So as she said, the headaches or the seizures, or sometimes it's just not talking. So
Yes.
selective mutism, or they truly don't remember. So you can have the selective memory loss also. They don't remember nothing about it, and maybe with time, the flashbacks will happen. But yes, the child can shut down, whether it's mentally, physically, emotionally, they shut down.
This is so informative and I am learning. So I'm hoping you listeners out there, you're taking notes, you're listening. Very informative. I'm so happy that both of you came on board to join us.
Awesome.
Yes. You made mention of something which I'm noticing right now. It's almost becoming a trend. Seizures.
Mhm.
Can you speak on this?
Okay.
Oh, man.
So a seizure essentially is an uncoordinated but it's synchronized. You have current shooting through your brain, and that's the reason why we're here talking, walking, moving our arms without thinking. The brain is in control. However, we have a part of the brain that's excite, so we call it, that basically sends a signal, and you have another part which is inhibitory, so it inhibits. So there's a balance between excitement and inhibition. When the excitement part of the brain sends too much signals and the inhibition part is not enough, then that's manifested in seizures, right? We have many different types of seizures. You could be jerking, staring, chewing, walking, blank stare. But when you have more than one seizure, that's when we say epilepsy. Once we make sure there is no mass on the brain or no intoxication of drugs and all of that. Yes, we do see a lot of seizures, and like, for instance, a baby cannot fake a seizure, right? But there is an age group where, like, once you're past a certain age and you come to the ER, then the suspicion of it is truly a seizure start to come more to the forefront. So if you're like a teenager and it's exam time, we know sometimes the stresses of even just an exam without no assault, just the tension alone can make you go into some spasms. But you do have some who they would have had a first seizure, And because they're not coping well with whatever, whether it's a divorce or a death or something, then this is the only way they know how to get media attention. So they may have more seizures.
Heritage
And
selections.
those persons will need some amount of counseling to learn how to cope. So we still don't say, oh, she's taking it, send her home. We realize, okay, something is wrong. Because nobody ever wants to just start to shake like that. And we try to pinpoint, as Doc said, that screening thing interview we do, we call it a heads. We screen them, we figure out what is the stressor, and we work with the stressor to try and get them to know a healthy child should not just be coming to the ER for this thing, But if you can't control it and you are having the jerks and the frotting and everything, we would put you on medication. But you have many different variants, some as babies, some as the childhood period, and some as teenagers.
Okay, good. You said something, Dr. Bukun,
Mhm.
that trauma, like you're older now, but childhood trauma could bring about a seizure. Was that correct? Okay, so could you speak
Or
to that?
or a seizure-like activity.
Seizure-like activity, right?
Right. So the public will know, okay, some random jerking, you falling down, shaking, eyes rolling back. It's a seizure. So they would bring you to the hospital, of course. But as physicians, we are trained. That's why we do 7 years of school and we can differentiate, right? So let's say I load you with seizure medication and it does not stop, then I would have to say, okay, no, there's something deeper here than that's not, physical. So I would have to dive into that history. And sometimes my consultant would pass and Christine would say, do it over tomorrow. See if you can dive deeper. Or doc would say, no, there's something there that they did not say. So, just revisit it again. Get somebody that he or she's more comfortable with speaking, and then let's see. But there's something there, because then we would describe it as something that's pseudo, which would be like false, like a false seizure. Because no matter what investigations we do, we can't seem to find any evidence that is actually happening to the brain. So you're good, doc. So we tend to merge both that part of the history with our physical based on what we're seeing, and then we could get the proper treatment that child, because sometimes it's just a psych consult that child needed, or to see a counselor or psychiatrist to see whether or not what actually happened and that is manifesting now as that. Mhm.
Because I've heard that certain seizures are brought on, as you said, from the trauma. We're tending to see some of that now coming manifesting. Yeah. So because of confidentiality issues, we cannot see it so much. But I'm happy that that was addressed. Okay. Are you doing?
I'm okay.
Okay.
I didn't have a seizure. I'm recovered. I'm fine. Hospital needed.
So yes, also we have two doctors. Yes, one will take care of the other.
Yes.
Great. Yes. So we're back to sometimes they say the power of the tongue. So when you speak of when you speak of certain things, you say you speak it into existence, but that is not what's happening. You're just taking a very humorous break. All right. So back to our discussions, and today the station has been so generous to give us a lot more extra time. So
Not a lot more. 10 more minutes.
anyway, so back to you, doctors. Yes. So when we talk about sexual abuse and trauma, that's where we were at. The after effects of sexual abuse.
Yeah.
Yes.
Mhm.
So the after effects of sexual abuse, we did say about sexual abuse and the trauma part of it. like Dr. Propon said earlier, that counseling should not only be given to the victim, but also to the family. And that is very important because you find sometimes the family cannot deal with this child. And as you were saying, Dr. Christian, that this child will act out because this child does not know how to deal with this trauma that comes with it. So speak a little of, if you could speak a little of some of the reactions that children give after the trauma of sexual abuse, some that you know of, and also maybe ways, if we could get some recommendations on ways that the family could deal with it.
Okay, well, the most common one is the tearfulness. And even though it's not a period of death, they will still have some amount of grief. So, all of the stages of grief. So they will blame, in grief, you want to blame somebody. In the sexual assault, they blame themselves, right? And then afterwards, they start to bargain, well, maybe if I didn't go down the road, maybe it wouldn't have happened. Acceptance, years before they go to the point of saying, well, it happened and I was not responsible for it, right? Some persons never reach to that point. Never. And they may flip flop between the different stages of it. So one time they're good, next time they're going back to bargaining. If only I could change it, and so we have that. Also, there's a cheerfulness, lack of appetite. So like the whole day passing and they're just crying and they don't want to eat. Sleep is interrupted. If they do get sleep, maybe you're lucky if they got maybe half hour. And that half hour sleep is not restful. The brain is still racing and racing, and they're waking up, and especially if maybe it was an intrusion at home, the home environment doesn't feel safe anymore. It's been violated. When Dr. Papone spoke about the lashing out, so it's like like the anger directed at everyone. Some persons don't want to go to school, so let's say it happened on the way from school. They don't want to go to school because walking in that road remind them about what happened there. A common thing that we're seeing now is everybody have a telephone, so everybody's sharing videos. And so it's like maybe they may not want to be in social media anymore because, or maybe they met the person online and the person, lured them into a vulnerable situation. Or if the person at school spreading it, so they don't want to go to school anymore, they want to change school, or they're out of school for a whole year just because of waiting to be placed and just not coping well, the grades start to fall. Maybe not a good school performance. And then now we spoke about with the parents in terms of now the mother herself blaming herself or the father because we failed to protect our daughter. No one ever wants to know this is their child going through it. And it's like, this is my baby. I remember the day I first held you, you were pink and you were rosy, and I was supposed to protect you, and I failed. And seeing their child going through this, they feel helpless, and I can't help you, right? And then they look at the other sibling and like, well, you're not going on the road anymore because that happened to your sister. So the other siblings now are living in the shadow of this emotional trauma that happened. So it is like right there and there that the home dynamic is like the trust of everyone is broken, and we have to start all over again. As Doc said, let's create a safe space to speak to each other. I will allow Doc to speak some more about that, but counseling, the counselors privately are willing to work with the victims. The public system is such a huge, it serves a wide subset of the population, so not everyone might get counseling in time at the public level. And I mean, I know it's not cheap privately.
I was just about to say that.
So in the absence of that, if you have a good school guidance counselor, we've had to call on a few guidance counselors, even if it's not sexual assault, but if a child is not coping with their asthma or the epilepsy, we ask the school because the counselor will see them more often than we do. If they go to church, our pastors are still very good counselors. You will know your pastor if he's what relationship you have, and some persons will go and confide in the pastor. Sometimes it might be the favorite auntie. So I will speak to Auntie Ingrid because she's the one who I go to and tell all of my troubles, or maybe grandma because grandma knows how to comfort me. So you have to ask who's the person you get along well with, right? And we're always there. We try to provide that environment, but I can tell you more about like the family.
Yeah. So if the family is broken over that whole situation, the victim cannot heal. There's no space to heal, right? So it's like your dad will always look at you some type of way. Your mom would react some type of way. Let's say you're going out with friends and they know that happened. There's no trust in the family. The healing cannot take place. And let's say if you do decide to start, start the process of counseling, but it's just you as the victim, who knows, maybe your counselor gave you some task to do to help with the healing process. The family does not understand it. So it's like there's you don't want there to be some type of space that, because if my mom is not on board, how am I going to be free within the household to do what I have to do to help myself heal, right? So I think it is like we should even start more towards the family base, trying to get them to that safe space. Let the parents know, because 2025 knowledge versus the time when we grew up type of knowledge is different. My dad might not understand what is happening right now, or he does not have that knowledge, or that was never exposed to him growing up as a child, right? So we need to get them like, despite of the individual counseling, the family counseling is also very important to help that child heal, because that child is going to need their family more than anything in that situation. And if you feel like the family is against you, then even more blame falls, the victims blames themselves even more for that situation, and healing cannot take place at all.
Thank you so very much for that. And I'm hoping that you listeners, you are hearing that the child needs a very good support system. And not only within the family, but within the schools, within the churches. And family members, you too, you as well need the help as much as the child to help cope, to help this child cope. And you as well to help you cope. And we hear sometimes there's a lot of denial, especially if it happens within the family. For example, maybe a brother molested a sister. There's a lot of denial. So, can you speak of that? How would maybe okay? Mommy has her siblings. Have her two children. Sorry, not the siblings. Mommy have her two children, and an older brother and a younger sister. And then she has found out that the brother molested the daughter. Can you speak of that as to maybe how should mommy go on? I know that we get the counseling. Okay, that time of this examination, you come and the shock is all there, and the denial and the blame and everything is happening. What should mommy do?
So, in a hypothetical situation like that, what I would probably recommend, if there is another home where we can separate the siblings in the meantime while I guess the investigation is happening, I would recommend separating, because we're still investigating and trying to determine exactly what happened. And we'll have to come up with an alternative plan. Let's say, okay, so they live in this house, they're siblings, but it did happen, then it means the perpetrator will definitely need intense counseling. We may have to keep them separated for quite a while we try to heal and allow each person to know what went wrong and how it was wrong and why it shouldn't happen again. And we live in a society where yes, some persons have the luxury of having multiple bedrooms, but not everyone has. Some persons have a big open space and it's one bed and multiple occupants in that house. And so we would have to probably advise that, okay, maybe somebody needs to get their own private room attached to the house. So how are we going to do it? Maybe with social worker, we get help to have better improved privacy when it comes to, these teenagers. So these are hypothetical things I would do if I was facing a situation like that where this happening under the house between siblings. And we would have to find out what happened to that boy, why these thoughts would cross his mind. Was he also abused? Because remember, the boys are also being abused too. R. Kelly is a perfect example of that. It was a very close family member who, engaged him at first, and now he had this hypersexuality, and that now caused him his whole career, and he's now in jail. So these things can have long-term side effects. So what happened to the boy? Why would he do that? Something, was it pornography viewing on the phone? Sometimes it's that. So that's how I would manage it. Hopefully, I will never get placed in that situation.
Okay, thank you so much. And another thing that I would also lament on that, mommy does not blame herself.
Right.
There's a lot of blaming there that would say, I'm a bad mother. You know, I did not do something right. So, yes. And moving on to boys, that we always believe that nothing happens to the boys. It happens. Sometimes I wonder if it happens just as much as girls, but it's just not reported.
It happens. I wouldn't say not as much because what we found when we looked at the data, it was mainly females. Now it could be the boys are not coming, and that was one consideration.
Yes.
Culturally, is it taboo that if you go and report it, persons will say, but for instance, perfect example, when I was a teenager growing up in my country, at another prominent secondary school, this guy, as Ted Michel would say, he's fair skinned. And I guess he was very good looking to the eye, and some girls, they held him down. They were all teenagers and they assaulted him. It was reported. I don't think anything was done. But if that was to happen right now and then, they would say, but you had 5 girls yourself. Why are you complaining? But it was against his
It
will,
was against his will.
right? So you would have a situation where it's heterosexual, but if it is both of the same gender, male and male, the shame is even worse.
Yes.
And it could be the reason why maybe we didn't see that much males presenting. Because it's like, okay, well, don't talk about it. Because if you talk about it, it's going to be worse for you than helpful or beneficial.
It happens because you find because males have this ego, okay, they would feel that it's a bruise to the ego, and people find out. And in Sandrisha, we like to use the word bula. We say some bula, that's so. You know, you would say that. So that happens, and you hear people say he wanted it, and maybe we say have been doing that for a while. So just as it affects the girls, it will as well affect the boys.
Yeah, and I think most of them are just not ready to fall for that stigma that comes from our society that classifies them, like you would say, into that category and cause them even more trauma, so they won't come forward.
Okay. So males, it is okay for you to come forward. You have your trusting physicians here, you have your social worker, you have your counselors, you have your police officers. Okay? And I do believe that sometimes some males, the way you handle situations, persons in authority, the way you handle situations has a lot to do with the outcome. So for example, a male comes to another male who's in authority and says, I was sexually abused by another male. Sometimes the first reaction would be, stop, you know, burst down laughing. Right away, this person shuts down and sometimes turn their back and leave and say, you know what, that's fine. Even females will tell you that they have been sexually assaulted, and because of the process, the legal process, they've just said, you know, just forget it. Because here the social worker will ask me, the doctor will ask me, the lawyer will ask me, the judge will ask me. It's like I'm being remolested all the time by repeating everything. So I just wish there was another way in which to do it, but unfortunately, this is how
It is on
the
here.
system,
Yeah.
the system is.
Because in other countries, depending on your age and your psychological state at the time, they may do a video interview, and that is actually, like basically given to the courts. But that's not something that's wide across, right? And if it happened when you were 3 years old, you cannot really explain exactly what happened. And if the case get called 5 years later when you're 8, you're clearly not going to remember the details. It might be contradictory. But on that note, I would just use the opportunity to encourage anyone who feel like, the process is taking too long or it's too difficult. Nothing like it's for, if maybe we push, maybe the one person that we can catch or that gets caught, you may then find maybe 10 other victims saying, yes, it also happened to me. So it's for you and it's for the other 10 voiceless persons that just never had that opportunity to say it happened. So don't give up. Don't give up.
You heard, do not give up. And we're encouraging persons to come forward because yes, it may be a tedious process, like we said earlier, but just remember the effects. It's a lifelong effect. So if you don't deal with that trauma when you were younger, you were sexually molested, abused, and so on, you grow with that hurt and that pain and that bitterness as an adult. It will manifest itself at some point. So it's good that you get the help as soon as possible. Okay? So don't think that it will go away. I can deal with it. Or if as an adult you never reported it as a child, as an adult, still go for help. You may not, well, you could go out there and report it because they've always said it doesn't matter
Mhm.
how much time elapsed, but it will be a little more difficult because of the evidence, but still get help for yourself in terms of counseling and so on. Get help for yourself because it's very important that you do so. All right. So we've come to an end of our program. Again, I'm thanking Doctors Christian and Dr. Popon. I said it
Yes, you
correctly.
did.
And the Unknown Solutions, she is from, Dr. Popon is from Dominica, and we have Dr. Christian from Antigua with us today. And they're coming all the way from OKE Hospital to be in studio with us in Sufre, and I'm so grateful. Thank you so very much for being here. So I'll let you see. It's not like you're dying.
Yeah, so from one young lady to the others out there, I do encourage you to report the situations of sexual assault and try to come in as early as possible, not just so that we could get evidence, which is one of the main reasons, but in terms of further protection against sexually transmitted diseases that we might pick up, or even to help prevent or let's say navigate through unwanted pregnancies that actually these things do result from assault. So just take the courage and let them know that hey, this is for my betterment. I know some parents do not want to go through the tedious process, but it is for not just the betterment of the victims, the family, but for our society, to help our society be a safe space for our future kids growing up.
Thank you, Mose.
Thank you very much for having us here today. Just to recap, just a reminder again that both genders are vulnerable to any assault, whether you're a child or you're an adult, male, man and woman, boy and girl, we're all vulnerable to this. So we just need to keep highlighting the fact that it is happening, and hopefully with more awareness we can work towards actually lowering the amount of persons who are exposed to this ill exists in every society. Okay? Parents, be extra vigilant. Not to say you're going to be extra paranoid, but look out for the signs. Speak to your children. They're very smart. If they can navigate and find YouTube and find all kind of things on your phone, speak to them about good touch and bad touch. Reiterate it, and very important. Do not use fancy terms for breast and the other private parts. Use the words in the book, because there was a situation where the child kept telling teacher, uncle is eating my cookie, and teacher did not understand what the child meant because she was not taught the word.
Yes.
So use the right term, tell them don't want you to touch here, there, wherever, and encourage them. I know it's hard sometimes when we stress, we reach home, we're tired, and the child bouncing off the wall, but try to find that moment in time where we sit down and we speak and allow the child to speak and know your child, okay? And just trust them and report, and then as Doc say, follow through. And let's just work to just try to make society better. I mean, it may seem far-fetched, but on the healthcare system, I know we have a lot of work to do. The waiting time is long, I will admit. The process may not be as perfect, but that's why Dr. Popone and I were here, because we're working to try to make it better. Even if it's 1% better, we're trying.
And thank you so very much for that. And as you were saying, I just remembered, it is vacation time, summertime. Parents, be very vigilant. Parents, please investigate where you are sending your child. Parents, please educate your child that it is not acceptable. It is not, at no time, whether it be your uncle, your brother, your godfather, whoever it may be, it is not acceptable to give any bad touches. All right, so because most times, the highest rate of molestation happens during the summer. So parents, please keep your eyes open, be vigilant, know where you are sending your child, and listen to your child. if when you call to find out, hey, are you enjoying the vacation? Are you enjoying where you are? And your child is crying, I want to go home, I don't want to stay here anymore. Listen to your child, bring your child home, please. Okay? Find out why don't you want to stay there? What is happening? Listen to your child, believe your child. Do not say, oh, Dr. Christian will never do that to you. And it's not only done by the males, it's also done by the females. Okay? So if your child comes to you and said, Auntie Sandra touched me. What? Auntie Sandra touched you? But you're a girl and she's a girl. It happens. Okay? The boys who go, Uncle Tony touched me. Yes, Uncle Tony can touch him as well. Just like Auntie Sandra can touch him as well. Okay? So adults do things to children. So please be very vigilant, especially during that summertime. Okay. Thank you so very much for listening and till next time. Thank you again so very much for being here.
So thank you for having us.
Right.